Hey, this is a kind of a follow-up to an interview we did yesterday. Yesterday, I had the chance to speak with former leader of the provincial Liberal Party, Raj Sherman. Also, that's Dr. Raj Sherman, as he's a longtime ER physician in our fine province. And he's been coming out and rallying against the current state of healthcare in Alberta. Now, one of his greatest, points that he wanted to bring forth is that hospital beds in our province are being kind of clogged up by patients when you talk about patients that could use ALC, which stands for alternate level of care. Now, that's a designation for patients who are occupying a hospital bed, be it acute care, rehab, mental health, but no longer require the intensive 24/7 specialized services. So, in other words, maybe a lot of these patients could benefit from home care. That's what Dr. Sherman is putting forth. Obviously, there are many different cogs within the healthcare system, but would home care and would the current structure in place be enough to be utilized and have an impact on our healthcare system? Well, to discuss, we're joined this morning by Dr. Sharon Anderson, Project and Research Coordinator with the Caregiver-Centered Care Initiative at the University of Alberta. Good morning to you, Dr. Anderson.
Hi, good morning.
Good morning to you. And now this ALC, these patients that perhaps don't need 24/7 care, home care has been listed as the option. Your thoughts hearing that from Dr. Raj Sherman?
Yeah, absolutely. We definitely need more home care. If we're going to move services back into the community, this is critical. However, we need to keep people out of the hospital to begin with. And Alberta has lots of programs. In Calgary, Dr. Vivian Iwa has actually made sure that there's primary care, in primary care networks, there are care of the elderly doctors that do those assessments and handle that complex care. The home care program, Dr. Alison McKelvey-Josa from the Calgary Specialized Geriatrics is actually training providers to work with family caregivers, because it's family caregiver distress that often takes them into the hospital for those unplanned hospital visits. And yes, at the other end of things, getting people out of the hospital earlier, Dr. Michelle Grinman, again in Calgary, has hospital at home, and Specialized Geriatrics, the Hospital at Home program, are working with the Weigh-In Network at Calgary and Korea, because what they're doing is they're actually making sure that patients stay out of hospital once they're discharged home, that those services are available. Not only home care, but also oftentimes it's people have they don't know where to find their bank, or they've lost they've been in hospital for a while, and they're worried about losing their housing or things like that. And those social workers at Korea and the Weigh-In Network in Calgary are just fantastic. We have the programs here in Alberta to do this. We just have to put them together.
Now, we got the programs, as you mentioned, but do we have the programs if we move more proactively, Dr. Anderson, and, emptied out some of these beds for people who don't need to be there? But what if there was an influx into the home care system? Is, the structure in place to handle that? How much, uptake do you have from students wanting to get into this line of work? And would resources, human resources specifically, be enough to handle that?
Yeah, absolutely. What happens is there needs to be more case managers in home care. There needs to be more of those assessments earlier, the geriatric assessments that are done by those care of the elderly doctors in primary care. There needs to be connections with primary care. Oftentimes, those things are not happening. That discharge home, so there's really good research that shows that it's caregiver distress that actually predicts whether or not the patient is going to be able to come home from hospital. It's not that patient acuity. So paying attention to caregivers is really critical. It's
a conversation that we're having with you, Dr. Anderson, and it's a conversation that has been bandied about a little bit more, across our province over the past few months from what we've been seeing. So we appreciate your clarification.
Yeah, what happens is we're concentrating on what's happening in hospital and getting people out into long-term care. And yes, that's part of it.
Yeah.
But it's the upstream piece and what happens in hospital and paying attention to caregivers in hospital, making sure that we can get them out of hospital sooner. every day that an older person is in hospital, they become more frail, about 18% of their muscle mass in a day.
Yeah. We're tight for time, Dr. Anderson. We have to move on. We've got a commercial break coming, but appreciate your time this morning and shedding some light on this. Thank you so much.
Okay, thanks very much.